Do you have heartburn? Do you have regurgitation of food? Do you smoke a lot? Do you take alcohol? Are you taking untimely food? Please watch this video till the end. Welcome to DD Healthcare channel. Today in this video, I am going to talk to you about a common disease called GERD, gastroesophageal reflux disease. I am Dr. G. Manoharan, a surgical gastroenterologist, Chennai. The GERD is very commonly seen nowadays because of the lifestyle modifications that we see in this modern world. What is gastroesophageal reflux disease? Before we understand what is GERD, we must know what is the normal physiology of our eating. Only when you know this, we can understand what is the GERD better. So when we eat, we put the food boluses into the mouth, we munch it nicely and then swallow. Once it goes into the throat or the beginning of the food pipe, you lose the control, it becomes an involuntary act. From that point onwards, the food bolus is taken slowly by the food pipe towards the stomach within about 18 to 20 seconds maximum. And when the food reaches the lower end of the esophagus, there is a food pipe, there is a valve, it opens out and allows the food bolus to go into the stomach, and then it closes again. Bolus after bolus we eat and we complete the food taking process and the stomach is filled with food. At that point of time, the valve at the lower end of the food pipe should remain closed. If there is any incompetency, meaning if it is going to be lax, the valve is not going to act perfectly, or it is intrinsically structurally normal but opens out unnecessarily without any provocation, what happens is the food is going to come back onto the food pipe. So this is a normal process of eating. So what happens in GERD? We will go into it. If you look at the incidence in the society, it is about 20% according to a study in USA, but if you look at India, it should be more than 25%. That's what we see in the common practice. So 25% of the population is a very huge number. So what is the etiology? Why it comes? For a given patient, we may not be able to establish the cause, but we can identify certain risk factors. Risk factors in the sense age. People who are aged above 50, 60, people who take alcohol on a regular basis, who smokes cigarettes, and then certain medicines that they take for the other illnesses can also produce weakness in the valve at the food pipe. Sometimes intrinsically, and the esophagus motor activity, the peristalsis may be ineffective, or the lower esophageal sphincter, that is called the esophageal valve, may be weak, or it may open up inappropriately in certain situations, or there may be delayed gastric emptying. The stomach may not empty its contents into the small intestine on time, and sometimes intra-abdominal pressure. See, those people who have obesity, these people have heavy intra-abdominal pressure that can also predispose reflux. And temporarily pregnancy can also do that, either because of the hormone or because of the gravid uterus. Then heavy exercises, people who lift heavy weights can temporarily increase the intra-abdominal pressure, predisposing the weakness of the valve and thereby the reflux. As I said, when the food goes from the food pipe into the stomach, the valve closes. After the completion of the eating process, the stomach mixes up the food in such a way that it can be transmitted onto the intestine and make it as a chyme. We call it as a chyme. The time taken by the stomach to empty its contents into the small intestine varies from 2.5 hours to 4 hours, depending upon the type of food that you take. If you take easily digestible food, you can empty it in just 2 hours or 2.5 hours, whereas if you take complicated food like spicy, oily, deeply fried food and all that, it takes longer time. It is better that you have a early emptying, particularly in the night. If you take a light meal, it's good. So what happens is in GERD, when the stomach tries to empty its contents into the small intestine, since the food pipe valve is weak, there is a gush of food that goes back onto the esophagus. What if it goes? But when the food goes from the food pipe into the stomach, it is only the food that goes. Whereas when the food comes from the stomach to the esophagus, it comes along with the acid, hydrochloric acid, and digestive enzymes. The inner lining of the food pipe is not constructed to withhold or withstand the assault of acid and enzyme attack. The natural defense mechanism that is there in the esophagus is peristalsis. See, whenever some acid reflux that happens, there is a peristalsis that occurs in the lower end of the esophagus and washes it away, pushes it back into the stomach. The reflux of acid from the stomach into the food pipe is not very uncommon. It happens for everyone. But the natural defense mechanism is there is some amount of resistance and peristalsis that occurs, pushes the acid back into the stomach. That's called involuntary act. And there is another mechanism is saliva. See, the saliva that secretes in the mouth is alkaline and we swallow it and then neutralize the acid that comes back into the food pipe. But if the reflux is going to be repetitive and the quantity is going to be enormous, then the damage is going to be there, and then these patients are going to develop the classic symptoms of GERD and they become patients of reflux. What are the symptoms these patients will have? One is heartburn, that is the burning sensation behind this sternum, the middle of the chest, and then the feeling of regurgitation. The patient feels that the food is flooding back onto the food pipe and come up to the throat. These are the main symptoms of the GERD patients. And there may be some other associated symptoms like recurrent pharyngitis and then sinusitis, then enamel erosions of the teeth, and then otitis media, that is ear infections, and recurrent aspirations of the reflux of acid causing recurrent pulmonary lung infections, bronchospasm, asthmatic attacks. All these are all called non-esophageal complications of the reflux. Patient can have all these problems and they go to the ENT surgeon or chest physician thinking that it is their problems. But basically, if you look at it, the ultimate underlying cause is the reflux. So the symptoms are regurgitation and heartburn as far as the esophagus is concerned, but they can have a kind of global sensation, that is something is obstructing in the throat. They will be able to swallow food properly, but when they are not swallowing, they'll feel a lumpy sensation in the throat. All this is because of the reflux. Okay, how will you evaluate these patients? How will you diagnose? See, a physician, when the patient goes, they just by analyzing the history and symptomatology, they can find out that it could be only GERD and then put them on a drug trial. The appropriate drugs like PPI, we call it as acid suppressors. If they give it for about 2 to 3 weeks, if the symptoms abate, that means we are indirectly confirming the diagnosis. Even if there is a doubt, probably you can go in for a classical standard of care is endoscopy, upper GI endoscopy. You put in a scope and see whether the food pipe and the stomach are injured or eroded or inflamed. Okay. Endoscopy gives a good idea about the severity of the disease, and that will help the physician how to treat the patient, how long to treat with what medications. In case if the symptoms are not abating even after appropriate therapy with adequate length of time, then probably you may have to consider other investigations like the gastroesophageal pH monitoring. See, there is a device we put into the food pipe that it will be kept there for 24 hours, and then we will identify how many times these patients reflux, how bad it is. All that we can grade accordingly. If the medicine fails, probably you may have to consider those patients for surgical treatment. Yes, though it is a medical problem, sometimes some patients may need surgery because the constant reflux and reflux esophagitis can ultimately lead to some cancer. So adenocarcinoma of the food pipe is very common in patients who have a prolonged reflux disease. So we may have to cut it short by medicines. If it fails, probably we'll have to go for surgery, surgical correction. In this video, so far we have seen the basic concepts of what is GERD disease, how it occurs, for whom it affects, and what are the symptoms and how to diagnose it. In the next video, I am going to talk about the treatment part of it, how these patients are going to be treated effectively. If you have any clarifications in this content of the video, probably you can put it in the comment box. And if you don't have any symptoms which are described in this video, you can please share this video to those people who have similar symptoms, because the GERD is a very common disease. Thank you very much.